Hello, I'm Richard Hara, and this is Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. I'm pleased to welcome to our program today Dr. Yamile Martí and Ms. Sofia Sierra. Dr. Martí has taught at the Columbia School of Social Work since 2011. She holds an MA from Teachers College and an MSW and PhD from the Columbia School of Social Work. Her clinical experience includes working with people affected by substance abuse and mental illness, children and families in the child welfare system and in public schools, cancer patients, abused women, and abused and neglected children. Dr. Martí has conducted research on the implementation and evaluation of teacher training interventions for empowerment, as well as a community empowerment intervention in Puerto Rico. She's also collaborated on a 5-year randomized controlled trial comparing the effectiveness of interpersonal therapy versus complicated grief therapy, and on other research projects related to young women who are pregnant and in foster care, and the experiences of foster care mothers. Our focus today, however, is on Dr. Martí's interest in the globalization of social work education. She has conducted research on intimate partner violence, contraception, and economic empowerment among Jordanian women, and has worked as a social worker in Jordan and in Puerto Rico. She has also served as a consultant for UNICEF in Abkhazia and Macedonia. Dr. Martí has developed courses at CSSW that includes travel to other countries during spring break for students to experience and thus better understand social work practice outside the United States. This spring, her course focuses on Chile, and we're happy to include in today's program one of the students who will be participating in this course, Sofia Sierra, who is a second-year policy student in our master's program. Ms. Sierra and Dr. Martí, welcome to Social Impact Live.
Thank you.
Thank you.
It's great to be here, and we've been talking about global social work most of this month of December, so it's a wonderful opportunity to talk about how our school is really trying to promote a more global perspective in social work education and practice. So let's start off with your story, Dr. Martí. I understand you have a master's degree in education, is it from
In
Teachers
psychology of
College?
education.
Oh, okay,
Yeah.
all right. And how did you get into social work?
So I did my first master's in social work, and then I always knew I wanted to do a doctorate, but was confused or considering both social work and psychology, and decided that a second master's will give me exposure to the topic of psychology and how it's practiced, but quickly realized that my heart and my mind work more as a social worker when we look at person and environment, so decided to come back for my doctorate in social work.
Okay, but you've got clinical experience, practice experience. So where did you get that experience?
So I work as a social worker at a public elementary school, running a program for children who are at high risk of abuse or neglect in homes, and also in terms of attendance to school and compliance. I have worked at the New York Psychiatric State Institute with patients who have severe mental illness, and also the parents of kids who have mental illness, on helping them understand the diagnosis. And I often work and consult with foster care agencies in the city to help them understand the many mental health issues that children in the system have and how to cope with them.
Okay, so, and was that your entree into doing international social work, or is that something that, how did that get
So
started?
that's a little bit of a separate interest
Okay,
as well.
right.
I grew up in a home where I was exposed to many different cultures by traveling, and learned a lot from that experience, and have lived abroad. And so I always, and having such an international student basis here, and students increasingly international or not being interested in global work, I thought it would be a great idea to kind of merge theory and practice and bring it at home to students, where they can get exposed to the culture, history, and politics of a country, but also actually go there and see it for themselves. And it has been a wonderful experience. And then my work as a consultant for UNICEF and UNDP has allowed me to also do projects of social work nature in countries abroad.
Okay. Well, speaking of international students, we've got Ms. Sierra here today, and I understand you're from Chile.
Yes, I am.
Originally, and you came last year to the School of Social Work. What was it that said to you, I need to go to Columbia School of Social Work?
Well, I work in Chile for 7 years in a nonprofit organization focused on poverty. That kind of moved me to think what happened if I try to analyze all this experience through like an academic lens. And I think like there is resemblances between Chile and the United States. So that was one of the main reasons to start looking for schools, and then trying to figure it out was a whole another thing. And I will say that the most interesting part for me for Colombia was how there was different tracks, different options to like pick different classes in different concentrations. So that sold me out.
Well, at our school, we have the 4 method areas, right?
Yeah.
Clinical practice, advanced journalist practice. There's also policy and social enterprise administration. And you're particularly interested
In policy.
in policy practice. So before I move on, I want to just remind our audience that we do have Q&A for the last 10 minutes of this program. So if you've got a question, please write it in, and we'll bring them up at the end to ask our guests. So, all right, so we've got this international piece going here. I'm just wondering, so you've developed this course, and how long has it been in existence?
So it started in 2011. The first reiteration of it went to Cuba. And the way the course is designed, it's really about the history, politics, culture, and development of the social work profession in the particular country we're going to look at, and how all of those factors have an influence on how social work is practiced on a daily basis. And so we cover all of that material. There's a lot of history lessons in the beginning of the course, and then when the students and I fly to the country, we visit everything from schools, hospitals, local NGOs, international organizations that may be present in the country, and really have a collaborative exchange. The idea of the model of the class is not to be a colonizing framework of we go here as experts to let you know what we know, but rather an exchange of information and really learning from the country that we're in and the people that we meet.
So could you give me an example of some of the things that make an impression on our students when they visit one of these countries?
So in Chile, for example, one of the visits that I think impresses them the most is going to La Victoria, which is a community that has a long history of activism, especially during the dictatorship that Chile went through. And we meet from local, there's a local health clinic there, and then we go into, for example, a radio station that was hidden in the time of the dictatorship, where they try to promote the other side of what was going on. And we meet with community leaders, and it's very tangible experience for the students to be just exchanging how that experience was when they were going through the military dictatorship, but also how the community has reinvented itself afterwards and maintain a culture of being advocates and very outspoken.
Good. It's a great experience, and I'm just wondering, Ms. Sierra, what it's going to be like, because now you're kind of like looking at through a different lens, right, to go there and so on. And obviously, you're going to be going this spring, and so and what are you trying or hoping to get out of this experience?
Well, I think that my experience is going to be different because I am from Chile, and I am proud to share that also, and be part of sharing like the different examples and experiences, but also having the opportunity to share that with people that it's not from the country. It will give a completely different perspective for me, and I think that it's going to be really interesting to see how students that I have been talking with but they don't know much about Chile are going to start talking about my country and our issues, and I think that's going to be really interesting. I am looking forward for it.
Yeah, well, I think one of the great things about this course and what you're doing is that, yes, I mean, it provides a learning opportunity for students, but it also allows us to tap into the wonderful strengths that students bring here to the school and to incorporate that into our classes.
Yeah, it's a course that allows students from each of the 4 concentrations, and that makes a very rich discussion in the classroom because students that are policy-oriented kind of have a different mindset than a student that might be more clinically oriented, and they actually kind of share that mindset and collectively inform each other. So it gives them an opportunity, which many courses in the school don't have, to take the class. And the other part of it, I think, it's the students also create a community within the class. And I have had in all of the reiterations of the class, students that now as alums have stayed in contact, have shared information, have worked together in collaborative projects post-graduation, because it's a very intense experience. And so I think that also builds community within the school as well.
Yeah, a great benefit.
Yeah.
I'm just, impressed by the potential and what it can achieve, both for education, and particularly this integrative model. There are things like a capstone project where students from different concentrations get together, but this is a wonderful opportunity and also very rooted, right, in a particular place and particular issues where students can really get a sense of how to integrate the macro with the micro and how what's happening at program levels. So that's tremendous. And the other piece that you mentioned about forging connections with colleagues and peers, both here in the United States and so on. I mean, what do you think the possibilities are, sort of in the future for students maybe to go back to Chile to do work, with a nonprofit, perhaps pursue a PhD if they're so interested? I mean, is this something that you are thinking about?
So throughout the years, we really have good connections to the people that we work there. One of the first classes that I took to Chile witnessed the reopening of the social work school at the University of Chile for the first time after the dictatorship. So more than 20 years of it being closed, because social work was always seen as too liberal of a profession to be practiced during the dictatorship. And so the students were able to witness the first dean of that school, which came back to the ceremony to reopen the doors of the school. And some of my students have stayed in contact with the professors there, and they have offered to maybe come for a summer or maybe do work. And so I think it just bridges community, connections, collaboration that doesn't have to be always US-based, and that for some of our students who might be from the United States but want to do international work, it also allows them to have, rooted connections in other places.
Yeah. And this is, but as long as you have the language ability and so on, for the most part, right?
Yeah, I think language is important. In the course itself, it's not a requirement.
Okay.
In the Spanish countries, I translate happily, and we have colleagues that help us with that. But language is also something that a lot of our students have the capacity and are bilingual or multilingual. And so I think it also allows for an opportunity to practice and see the importance of social work being practiced within a cultural language component. So, for example, when we visited in Chile, in Valparaíso, a trauma center, and we talked about intergenerational trauma, which is very prevalent due to the dictatorship in Chile. Our students in the U.S. come with a frame of intergenerational trauma that it might not be necessarily based on history.
Right.
And so being able to exchange what we do here versus what we do there, and the language in the sense of clinical skills and language is also a very interesting conversation.
Yeah. I'm just curious, do you sort of see international social work as this kind of, I don't know, a universal template for social work practice? So often, it seems like we have to adapt, right, our practice, our work to the specific needs of, population, individuals, and so on. And sometimes it's hard to see, so that something that really kind of transcends those kinds of definitions and limits and so on. So is it your sense that there is an international character to social work, and maybe you need a global character? Let's put it that way.
So I think it's something that it's increasingly more present in schools of social work and in research, but not necessarily in the practice and training of our students. Okay. And so as a student myself, I always thought our professors are doing great work all over the world. Why do I know more about that, and why do I learn more about that? So the idea of this class was really to bridge that gap of bringing that experience into the classroom. And we have had students that come from the country that we're visiting, students that have never taken a passport until this class, students that have always traveled around the world but never with an educational lens.
Okay.
And so I think the way that the profession of social work is moving, it's having a more global understanding of the world and how that influences my practice here in New York, but can also mimic my practice elsewhere as well. Always taking into consideration that history, culture, and the background of the particular place that you're working environmentally, it's very significant to the work that you will be doing.
Okay, so it's a two-way conversation, hopefully, right? And we're learning from each other through these kinds of experiences. So I don't know, in terms of your expectations and some of the things maybe based on just your year and a half here at the School of Social Work, do you think there's something particular to American social work that needs to be translated back to Chile, or vice versa? Is there something that you can bring from Chile that helps inform our practice here?
I say that social work is really different in Chile than in here, because in Chile we don't have clinical social work. So social workers are more concentrated in a macro intervention level, and it's really politically based, I will say. So it's really important how the different history and the context of the country have been modeling what we do. And for me, it was really challenging when I got here, learning all these things about psychology, and I was surprised. I enjoy it, and I think it's really useful, and it's something that we could incorporate much more in the practice in Chile. And also, I feel like I have learned in Chile how to plan or develop programs that I feel like in here it's like a tiny part or only like AGPP concentration, but it's not something that everyone has. So I feel like the emphasis are a little bit different. But I appreciate the effort to make the conversation about what's going on in social work in other parts of the world, because this is not the only class that visits other countries. So I feel like sometimes that is missing in the daily basis of the school. So I thought it was a great opportunity to share that.
Well, thank you for giving me an excellent segue to one of the questions that our audience has posted. I would love to hear more about what countries Dr. Martí has visited since the course began and what was the focus for each one.
So we had the course in Cuba and Chile. Dr. Akilova has done it in Jordan, and this year is taking students to Turkey. The course in my particular case is taught in kind of the same framework of understanding the culture and the history and politics of the country and the practice of social work at macro and meso and micro levels. And so any country that we take students to, kind of that's the framework that we have. Obviously, Chile, I'm not going to ignore the fact that it's going through a situation right now of civil unrest and protesting. So I think it's important for us to be there and for being advocates and being solidary with our Chilean friends. But I also think it's important to bring that reality that is happening in Chile to the course so that we don't just ignore what's going on, but we actually see how social work is part of that process as well. I'm hoping next year to take students to Kenya, and the preparation for that is usually a year in advance. So now in the spring, we're getting a committee together to start exploring that opportunity as well. So it will keep expanding, and we have too much world to cover, so it's not going to stop.
But we'll try.
Yeah.
Okay. Let's see. Comment from the audience. Hi, my name is Maria Paz. I'm writing from Chile, and I know Dr. Martí through Dr. Lukens. I had the opportunity of being a part of Dr. Martí's visit to Chile in 2016. Thank you for doing this event during this difficult yet momentous time for our country nowadays with severe and daily human rights violations. So there's a lot that's going on there, right?
Maria Paz is an excellent colleague and friend, and hopefully this year we'll see her again. It's a difficult time for Chileans. I think for myself, as somebody that has visited the country many times, seeing military personnel and violence in the street is very triggering. And so I think one of the main components will be to understand what's going on from all sides, but also to offer our support and our being, partners with them in this process. So hopefully our students will learn from people who have been going through this. And one of the places that we visit is the Institute of Human Rights, which is doing a lot of work in kind of recognizing the human rights violations that are going in there right now.
Yeah, it must be a tricky balance, though, as a social work professional trying to be involved, but at the same time be nonpartisan. We had Professor Abramovitz on the show recently talking about getting out the vote here in the United States and so on. And, we want to be involved. We're for social justice and so on, but at the same time, we're trying to balance the needs of multiple stakeholders, right?
Definitely.
In addition to our students' learning needs as well.
And my biggest priority is obviously their safety and well-being.
Right.
So in the middle of a country that is going through this civil unrest, that's a big concern. And so we're doing everything that we can to consider safety and making sure that if they want to participate in the protesting, they can, but always within a framework of safety and safeguarding their well-being as well.
Yeah. How long? It's 1 week or?
It's 8 days.
8 days,
Not
okay.
enough.
Yeah.
It becomes very short.
Yeah.
It's 8 days that are packed. We do a little bit of visiting sites so that they get to see the country. But it's really kind of an 8 in the morning to 6 o'clock full day of visiting different places. So they're going to have a jam-packed schedule.
Okay, well, you can look forward to that, I'm sure. And in terms of just, again, thinking about global social work and so on, do you feel that we're preparing students for doing that kind of work?
I think it's a work in progress.
Yeah.
We are starting to offer more things related to, like, for example, now we have 2 courses that take students abroad. It's one way of doing it. Another way, and I'm currently working with a student fellow from the Stephen Shinke Fellowship to try to do block placements abroad, which is a very different experience than the course. The students would take all their classes ahead of time and then use their last spring semester to go to a country and do work in a local organization. And so that's another way of doing it. I think also as professors, we have the obligation to make sure that we incorporate international focus in our courses, where maybe the readings don't all have to be U.S.-based, the concepts that we teach are not all U.S.-based, and we integrate the voice of our international students as well. Because some of the concepts of social work are not the same in the country, and so an international student can teach us what would that be in your country, and if at all it is practiced. So I think there are multiple ways that we can continue to become a global social work school and bring that to the students, because I think increasingly our student body is much more interested in the globalization of everything.
Yeah.
And because of social media and access to more things, I think that's something that is going to be a crucial part of their education moving forward.
Yeah. Let's see. Going to other countries to do social work sounds exciting, but are you afraid that students will receive only a superficial understanding of the issues, particularly if they don't have the language skills?
So that's something that I work really hard in battling every time that I design a course. I think I try to make sure that the language is not a barrier in this and that all the questions that they might have can be translated and there could be a dialogue and conversation. And it is superficial. 8 days is not enough, and it's not a comprehensive full view of everything. But I certainly try to bring in the itinerary that we design for the students, and even in the readings for the class, views from all sides, so that it's not my perception or subjective to me or to my point of view about what's going on in there, but it's really an objective look at history and policies that have been done and the practice of social work in the country.
Yeah. I mean, there's only so much that we can teach in a classroom, right? You need to go out and sort of see, and obviously there's a tremendous emphasis in social work education placed on experience, right? And I know Ms. Sierra was actually in one of the sections that I taught on MI skills. And I'm just now curious because we didn't have this discussion at the time, but now after listening to you talk about, sort of the more psychological focus of American social work training, was that an adjustment for you, sort of doing that kind of those exercises and so on in motivational interviewing?
Yeah, it was. It was a challenge, but it was really interesting, and I think it's a set of skills that was really useful, and I can tell that even for a policy student are really useful in general.
Yeah.
And I feel like, as Maria Paz said before, this is a difficult time, and for our country, And I feel like it's going to be interesting to share that. And I feel like social work will have a lot to do not only on what are the new agreements of our society, but also how to deal with the consequences that are also psychological, and the stress that all this is going to bring to our people. It has been 60 days already, I think, and there has a lot of injuries, mutilations. So the scenario is really, really hard, and I feel like everyone is going to take some time to process, and it's going to be difficult to heal from this. And I think social work will have a particular role in that, and I think it's going to be interesting to see in the class where are we as social workers as a discipline.
Sure. When you think about social conflict and you think about, well, what can we do to sort of remedy policy, and all of that is important, but at the end of the day, how are the different parties going to talk to one another, right? How are you going to come to some sort of reconciliation so that people can move forward together? Right? And I do think that, to put in a plug for the motivation, that we do try to emphasize those communication skills, in empowering sort of ways. So I hope it didn't feel sort of imposed upon you, that training and the kinds of exercises that we did, but I appreciate the context that you've provided me today for how you've received it. So let me see, there's another comment from the audience. I feel it's important to remark on what Sophia was saying on the very clinical-led social work in the U.S. Although it's important to bring in parts of that clinical analysis, practitioners in the U.S. should question why the work here is so depoliticized, which can be extrapolated to a clinical diagnosis of mental health issues as opposed to the environmental and material factors. To what extent do the students do hands-on social work? And so I'm sorry, I was skipping ahead, and I guess this is a question for both of you from the student perspective and also from the instructor perspective. Are we putting too much emphasis on the individual psychology part of it and not on environmental factors?
So I am truly an advanced generalist practitioner. So I look at cross-systems perspective and how these systems intertwine with one another, and how you cannot really look at an individual without looking at their environment. So that's very central to the way I practice my social work practice, and I teach. But I think in general, if we are looking at globalization and how the world is interconnected, we have to kind of have a lens to understand that yes, clinical work and individual work, it's important, but it doesn't come without looking at the other factors that influence it.
Yeah.
I agree. I feel like in Chile, at least the past couple of years, the discussion was that our mental health is like getting better and better, like worse and worse. And then all this situation exploded, and we started seeing that it were more structural, and it related with the sense of abuse from the system, from the structures of how, if I go to like the medical center, if I go to ask for the equivalent to stamp. So I feel like there is a relation there that we have to be a little bit more aware, and I feel like we talk in the school as like two separate things. Like you learn about the environmental structures and you learn about like clinical skills, but sometimes that conversation with the system is not integrated enough, perhaps, at least in my experience.
Right. Well said. Let's see. To what extent do the students do hands-on social work on these trips? Is it purely educational? So are you? Yeah.
So I don't I have not done it as an hands-on work for two reasons. Partially, we're only there for 7 days, and so I don't want to start something that we cannot finish.
Right.
But we do collaboration of, for example, at the University of Chile, the faculty, myself, and students present, and the students from there and the faculty present. So we have an exchange of information that it's informed by the practices of us in each of our countries, and also by just topics, areas that are important to them to cover and for us as well.
Yeah.
So there is hands-on in the sense that it's not just sitting there and kind of just hearing people present. But I don't want to come in and do a project and then leave and not have continuity of that relationship.
Yeah.
So
That makes a lot of sense. Last question, and it's a question for Sophia. So are social workers playing a major role in the current protests going on in Santiago and elsewhere?
That's
it's students. I thought it was a student. So is there...
So this started with high school students in general that start protesting for the rise on the ticket, like the subway ticket. They don't pay the whole ticket, but they responded to the birth of their family. So that was really interesting.
Okay.
They were not protesting for them.
For themselves.
Yeah.
And then I
Interesting.
remember after the first week, I was asking, where is the social workers discussing this on my Facebook and like trying to figure it out. And I think one of the things that social work has as a challenge in Chile is how to organize in terms of a national association. I have seen some interventions, but also it's really difficult being here to know exactly how they are building relationships and solutions. But I would say that we are probably not in all the conversations that perhaps we need to be. And I think we can be a great contribution if they let us. And I would say that they don't let us as much as social workers, so we're kind of fighting a space in general. So I feel like social works have a lot to say. We are the ones that are on the field with the people all the time, and when they say, oh, this happened, we are like, yes, we have like 100 cases like that one. So I feel like we can have that knowledge from the field that it's really useful.
Well, whatever you can glean from the field with Dr. Martí on this trip, you certainly need to bring it back here to the United States because we can use that expertise as well. So again, I want to thank you both for being on the program today. And thank our audience for tuning in, not just for today, but all semester. This concludes our Fall 2019 series of Social Impact Live. I hope you all have a great break, during December and January. We'll be coming back in the spring and hope to see you all then. Bye-bye.
Thank you.
Bye.
Thank you.